Good evening to everyone and welcome to today's session. Padmanabha, Rituraj, Sweta and many more who are all online. We have a new format of the broadcast. This is you apply a green screen in the background and everything else disappears and you can be more interactive. The teacher can be more interactive with the students. So please give me a feedback how you felt about this new format of the broadcast. We have Biju, Chandrakant, Hema Chowdhury, Ranjit, Rituraj, and many more who are all online. So today, let us start with the quiz first because the PowerPoint of biochemistry is getting ready, right? So shall we start the quiz? Excellent. In this new format, the advantage is you get the complete opportunity to view the PPT, and that's a great advantage. So let us see. Ritu is asking, do we have the whiteboard or not? Kyun nahi? I have this pen and we have got a electronic marker which is a whiteboard. So you can give me a feedback on that also, right? So let's make the great beginning, doctor. Yeah. A patient presents to the emergency with hypertension and ECG was recorded. What is the immediate management? So what is your answer? I can be able to see Ritu proposing DC cardioversion. DC cardioversion? Yes. So this is the typical ECG. So what is very important is you have the broad complex QRS, which is a very important feature about these waves. So what is your answer? That's good. I can be able to see DC cardioversion, especially when there is hypotension. Hypotension is a key feature here. So that makes DC cardioversion as the answer. Very good. A 20-year-old female comes with the complaints of headache, vomiting, and a decreased movement of the right leg. She had an episode of violent and aggressive behavior, and her urine sample is being shown to you. Urine sample. So, what is the most possible diagnosis in this given case? So, what is your answer, doc? Shoot your answer. Good to see 26 online students. The main advantage is I'm able to sit in the home and be able to deliver. I have set up a small facility in the home itself. So even if I am in Andaman Nicobar also, I can be able to deliver a class, a live class. That is an advantage of this format. But you should tell me whether you're all happy with this new format or not. Yes. What's your answer, doctor? Roshan, Madhu are differing between A and D. Madhu is thinking acute myoglobinuria. I know that is the most possible wrong answer. The reason is this color is the one which is making you to I think I could not be able to this is the color, right? You can appreciate the color here. Yes. Considering the overall history of the patient, the answer would be the acute intermittent porphyria, right? So the urinary ALA and the PBG, they are the ones which are markedly increased whenever the patient is having acute intermittent porphyria. Even if the patient is asymptomatic, there is a rise of them. And this portwine reddish urine is a very important clue. port wine reddish urine is an important clue to say that on standing, it is a case of acute intermittent porphyria. A patient with fever is admitted. His chest radiograph has been shown to you. Now, looking at this chest radiograph, you must be quite sure what is the diagnosis. In chest radiograph, what are the possible diagnoses, doctor? Either effusion, hemothorax, pneumothorax, pneumonia. These are the 5 to 6 things that you should be in a position to recognize on a chest radiograph. Now, the question is, if you look at the prognostic score of this patient, Deepika says, sir, we are happy that you are able to sit and teach. Actually, sitting and teaching is a more bigger punishment because standing and moving around will prevent deep vein thrombosis, right? So, Deepika, but thank you very much. You care so much and feel so much that the teacher should sit. Good. So now I am in a air-conditioned room in the home. You are also sitting in the home. Now we are both are equal, right? That's an advantage of this format. So Ritunaj is proposing D. Shweta says D. Very good. And good. Akhileshwar, welcome. Good to see 32 online students. So, doc, you should remember that there is something called CURB score. You need to know. So, CURB mein kya hota hai? This is one of the favorite question. So, CURB mein hota hai C for confusion, U for urea, R for respiratory rate more than 30, and the B is systolic blood pressure less than 90 or diastolic blood pressure less than 60, and the age is very important. So age more than 65 is also considered to be one of the important addition to the CURB 65 score for the pneumonia severity and prognostication is what you need to remember. Now, you are being shown a baby, right? Theek taraf dekh lena. Now, all the clinical features are seen in the mother who had infection while pregnant with this baby. After looking at the baby, you must have got what is the infection the mother had at the time of pregnancy that led to this dysmorphism in the baby who is being born. So now, doc, shoot your answer. What are the important clinical features? Except, yeah, question number 14. हाँ, फटाफट बोलना, आपका आंसर क्या है? Now, one advantage I am looking, if this goes well, you should all say that this is a good, this format is okay, the voice is okay, the broadcast quality is also okay. If you all say okay for that, then we will continue like this. One advantage of this is early morning 6 o'clock also. I did not travel all the way to studio and classroom and then deliver. Morning 6 o'clock also, 6 to 8 we can have a session. And evening, whenever we can plan at any time. That's an advantage of this session. Especially October, November, December jab aata hai, all students are vibrant to have interaction, to reignite themselves. So that is the time more in the single day we can have 2-3 sessions also. That's a great advantage if I happen to deliver the presentation directly sitting in the home. So you need to give me a feedback at the end of the session, how you felt about it. Good to see 41 online students, very good. Call your friends. Today teacher is from home, you are also from home. So doc, you should remember it is a Zika fever. So Roshan Yadav, Ranjit Shah, Argha Saha, most of you are correct. Gulenbari nahi hota, petechial rash, fever with arthralgia, etc. will be there. Now, you are being shown the guide in a polio patient. in the polio patient. Why is this guide is adopted? It is because of which muscle weakness the person need to go into this kind of a guide is a very important question. Good to see 44 online. Yeah. Is the voice loud and clear for everybody? Hope there is no resound or quality of the sound. If it is okay, the quality of the sound, I don't need to wear a mic. That's an advantage. Yeah. So, very good. Ritu Raj proposes quadriceps. No, doctor. It is the involvement of the hamstrings, which typically lead to this guy. It is what you have to be very sure about. Right? Satya Snigdha Tripathi says quadriceps, but hand to knee guide is mainly due to the involvement of hamstrings, is what you need to remember. Now, which is the test which you will do to diagnose this condition? You should know what is this condition and tell me what is the test you want to use. Yes, shoot your answer, doc. So, which is the test you want to use in order to diagnose this condition? Yeah. So, is it IGF-1, ACTH, Mala Krishna, Arga Saga, and Radhika Pillai? Very good. Radhika, you are from which part of the country, beta? Are you from Trivandrum, Calicut, Cochin? From which part is Madam Radhika Pillai? Good. Yes. Dragon Dreams is proposing IGF-1. Dragon Dreams Jindabad. That's good. So you should remember it is acromegaly, and that's the reason IGF-1. Now you have been shown a diffusion weighted MRI. Diffusion weighted MRI. So the window period for the thrombolysis in the patients whose diffusion weighted MRI is being shown in the figure. You are the casualty postgraduate on duty in casualty, patient arrived and diffusion weighted MRI done. So what is the window period for thrombolysis? Is a simple straightforward question. Yes, doc. So Manoj Singh, Brahmatirtha Chaturvedi, Ranjit Singh, they are all differing between C and D. Yeah, C and D. Yeah, please shoot your answer, doctor. Sailesh Kumar is proposing B. Madhu is proposing B. Yeah. So it is 4.5 hours. You have to be very precise on these values, doctor. Satya Snigdha Tripathi Jindabad. So also Dragon Dreams, who gave the correct answer. Very good, very good. Now, doc, 2 days after the surgery, this is the pre-operative. The first one is this is the pre-operative and this is the post-operative. Looking at both of them, right? You got an idea? Now, 2 days after the surgery, where pre and post pictures are given, the patient develops sudden onset of shortness of breath and a low-grade fever. What is the most likely cause? Is a very important question. Question number 18. Good to see 60 online students. Very good, very good. So please do call your other classmates and yes. Dragon Dreams, Arga Saha, and Immediate Corpse. Oh my God, ye kya naam hai bhai? And Madhu is proposing fat embolism. Absolutely right. Now, it is a case of fat embolism. Now, a 27-year-old lady, look at the histology, right? A 27-year-old lady and 20 weeks of pregnancy. 20 weeks of pregnancy. Presented with a thyroid nodule on the right side. And this is the histology. Which of the following is contraindicated in the management of, in her management? Yes. Good to see Commandant. Yes. Manoj, Ranjit Shah, Vishalakshi. Everyone is proposing C. Very good, very good, very good. So, absolutely, radioactive iodine ablation is contraindicated. FNAC is showing the orphan anide cells, which are the classical feature, which you see, the orphan anide cells are the ones which are classical feature in case of papillary carcinoma. And that is the reason the radioactive ablation is contraindicated, but right lobectomy, total thyroidectomy plus neck node dissection and total thyroidectomy, they're all indicated. Now, the following is a thyroid scan. Pehla thyroid scan ko dekho. Now, the most probable diagnosis of this thyroid scan, what is the most probable diagnosis of the thyroid scan? Yes. Very good. Commandant all the way, reporting from the casualty of Armed Forces Medical College. Good to see, Commandant. So, Alka Ravi is proposing B, lateral aberrant thyroid. Satya thought it as C. Okay. So, C is correct. Satya is correct. That, yes. It is hypersecreting adenoma is what you should remember. Now, a young lady, this is the young lady, okay. Now, a young lady presented with midline neck swelling and it moves with deglutition, swallowing. It is stable in size for last 1 year. What is the most likely diagnosis? Question number 21. Yes. Should you answer, doctor? Deepika is proposing C. And Shweta proposes A. And Vishalakshi thinks it is thyroglossal cyst. Vishalakshi Jindabad. Very good. It is thyroglossal cyst.